Hi there, Mom and Dad. Yung anak niyo ba ay may hika or na-diagnose with asthma? Marami ka bang tanong tungkol sa asthma? Ano ba ito? Ano ba ang trigger? Ano bang kailangan i-avoid? Ano bang binibigay ng mga gamot? At madami pang iba. Well, in today's Ask Me Anything episode, I will answer your top 10 most common questions about asthma. So let's get started. First question, what is asthma and how common it is in children? So, ang asthma ay isang chronic lung disease that causes inflammation or pamamaga and narrowing of the airways. So, lumiliit ang airways ng bata kung meron asthma attack, which in turn causes difficulty of breathing. It is the most common chronic condition in children, affecting millions of kids worldwide. Number 2. What are the symptoms of asthma in children? Well, ang pinaka-common na mga simptomas ng asthma sa bata is coughing or pag-uubo, wheezing. There is a wheezing sound that you may hear, yung parang pito. And then there might be shortness of breath or hinihingal, then difficulty of breathing or nahihirapang huminga. The child may also complain of chest tightness. And if you would notice, asthma attack usually happens at night o sa gabi, and it can also be induced by exercise or extreme physical activity. Number 3. So, how is asthma diagnosed in children? Well, doctors diagnose asthma through a thorough medical history and by doing a complete physical examination, and doctors might also do tests like spirometry. This is to measure lung function. For children 5 years and older, there is a test known as fractional exhaled nitric oxide test, which can also be useful to diagnose kids with asthma. So it is better you have this conversation with your pediatrician. Alright, number 4, and an important question. What triggers asthma attacks in children? Well, triggers can be due to allergens. What are some examples? So, pollen, dust mites, pet dander, o yung mga pets nyo dyan. Another trigger can be from respiratory infection. So, like a common cold can be a trigger for asthma. As I've mentioned, physical activity as well, or with exercise. Cold air. So, with the change in weather, the cold air can induce an asthma attack. And smoke is a common trigger of asthma. That is why it is important na i-identify nyo kung ano ang triggers ng asthma attack ng anak nyo so that you will try to avoid it to prevent further attacks. This is important in managing your child's asthma. Alright, number 5. What are the treatments available for children with asthma? Well, there are 2 types of treatment for kids with asthma. Treatment includes, the first one are quick relief medications. So these medications are given so that for immediate symptom relief for your child will be provided. This is in the form of short-acting beta agonists. It can be given through nebulization or through an inhaler. The next part of asthma treatment are long-term control medications. This is, of course, to manage your child's chronic symptoms or to prevent further asthma attacks. So, long-term control medications are like maintenance medications for your child's asthma. These can be in the form of inhaled corticosteroids. It is best that you discuss this and have this conversation with your pediatrician. Number 6, how can I help my child manage their asthma? So parents, mom and dad, it is important that you make sure your child takes the prescribed medications. You can also help your child by avoiding known triggers. So You are the best gauge of what triggers your child's asthma, and you should avoid that. It also is best that you monitor your child's symptoms. So check, does my child sleep well at night, or is my child coughing a lot, especially at night? And go to your child's pediatrician regularly. Attend regular medical checkups to monitor your child's asthma symptoms. And it is best that your doctor and you have an asthma action plan for your child. It contains detailed information like what are your child's quick relief medications when your child has coughing or difficulty breathing, and what should you do. It also includes your child's long-term control medications, like does your child need to be on maintenance asthma medications, and it also includes what are your child's known triggers that you should avoid, and it can also include detailed instructions about what to do if your child has symptoms and when to bring your child to the emergency room. So, an asthma action plan is important to have and to discuss with your doctor. Number 7, is it safe for my child to exercise if they have asthma? Well, yes, with proper management, children with asthma can safely participate in physical activities, in PE classes, and can exercise. Just make sure that your child has an asthma action plan. And discuss with your doctor if your child needs to pre-medicate or pre-exercise medications should be given if your child plans on exercising. So these are important to discuss with your doctor. Number 8, can asthma be outgrown? Well, it depends. Some children, they have a decrease in asthma symptoms as they get older. But in some kids, asthma may persist until adulthood, which is why it's important that your child is monitored by your pediatrician and to continue on what medications your child is prescribed, and of course, proper monitoring of your child's symptoms. Number 9, what should I do if my child has an asthma attack? Well, you follow the asthma action plan and give the quick relief medications, usually in the form of short-acting beta agonists. And also, monitor your child's symptoms after giving the quick relief medication. If this does not improve, you should bring your child to the emergency room for further care and assessment. Number 10, how can schools support children with asthma? Yes, schools is a big part and should participate in your child's asthma monitoring. And what I would suggest is to have an asthma action plan filed with the school so that the teachers would know what to do if your child has an asthma attack. And also, schools can help by providing access to the medications, and the staff can be taught on asthma management, and to make sure the environment in school is free from allergens or the common asthma triggers. Hey, if you like this video, watch my next video where I teach you about other child health problems.